guys, I hope you're having a fantastic day. Thank you for joining me. Today is Thursday, June 18th. It's been a little bit of kind of a rest day again. I had a lot of seizures again last night, and I'm missing about that much of time that I don't fully remember stuff, or the details I remember are not fully true. So like it's funny or like strange how like your brain kind of like alters stuff, and stuff from the past and present can kind of get mixed up, at least for me at times, and then like eventually I come around, I feel better, and I like remember what's going on. But then sometimes, like I said, like there's a gap of time where I don't really remember much of anything. So I was missing a little bit of time of last night, unfortunately, but I did have my gastroenterologist appointment today, and then the rest of today I've been doing like a little bit of Bible study stuff, and then really just preparing for the consultation with the surgeon tomorrow. It's going to be between a 2 to 2.5 hour car trip. So I'm definitely trying to just prepare for that, like mentally and physically, the best that I possibly can, because I'm not used to going that far anymore for anything. I haven't had a reason to go very far, especially due to the pandemic. I've been home mainly. So I'm trying to just, rack my brain. It's like, okay, like what should I be bringing in the car, like to make myself more comfortable and all that good stuff. So far I've definitely settled on bringing my heating pad. If you haven't seen it, I will put a link in the description for you guys. I absolutely love this heating pad. It is cordless, takes about 15 minutes to warm up. It stays like a nice temperature that I like, around 45 minutes to an hour. It does still stay warm, probably for up to like 3-ish hours, but it's definitely not as hot as I would like it to be. So I usually recharge it when I'm at home quite frequently. So and like I said, I've been getting ready for that appointment. So I wanted to talk about like some of the stuff that I'm bringing like to the appointment to make it a little bit easier on myself, because new appointments are just really stressful. At least they are for me. Like there's a lot of anxiety. I've seen a lot of terrible doctors over time. So there's kind of like just that anxiety of meeting a new doctor and everything. And like I said, it's a really far trip, and I just, as you guys know, have not been doing the best. So I want to make it easy. And this is just something I recommend. Like if you're chronically ill, this is definitely something to think about. I wrote down notes this way I didn't forget. So all my records and all that good stuff has been sent over to this facility. They're going to have all the test results and everything that they need with that. But my stuff that I'm bringing will just make it easier when I'm filling out paperwork. So what I am bringing specifically is a medication list, except for I did talk about this in another video. I've decided to make my medication list a lot more detailed because I ran into some issues at the hospital with people messing up my meds, and not just asking me when I take them, and then prescribing like medicine that's taken at night and then giving it to me in the morning, and it was just a big mess. So I am writing out specifically how many times a day I take something, the milligrams, what time of day. So like for example, with my steroids, I take that in the morning and the afternoon. So it says specifically, I think it's, I don't even know my amount off the top of my head. I think it's around 12 in the morning. It's all sorted out upstairs, so don't worry, I don't need to actually know this. So it's like 12 milligrams in the morning, and then it says 2 milligrams in the afternoon, and then 2 before bed. So it's like very detailed. And then like for my cromolyn, I take that 3 times a day, but I take it before lunch, before dinner, and then at bedtime. Some people do it before breakfast. If I do it before breakfast, I just vomit. I don't do well with it that way. So like I wrote out all those specific things because they actually do end up being important. And so first I have on my med list all my prescription medicines. Then I have, which are also prescriptions, but it's like a different section, my as needed medications. And then after that, I have my vitamin and supplement section. I wrote out like even the patches that I wear from Patch MD and specifically what is in them according to the website. And I did write down there from Patch MD, so if somebody wants to look that up and, you know, see what else they have or needs extra, I don't know, details on something, that information is there. Then I have an injection section and my infusions. Then I have medication allergies because those are definitely the most important. And then because this is a new facility and because I will be having surgery here, I have on a different list my generic like other allergies. So like food allergies, some of the soap allergies, of course the bleach, cleaning products, stuff like that. And then I have an illness list because I just find that so much easier. Once you have, I think, more than, I don't know, 3 or 5 illnesses, carry an illness list. It just makes it a lot easier. This way you don't have to think about it. And then I have my doctor's list, and then under that I have home health care, which is like my pharmacy company and nursing. And then I also have a surgery and hospitalizations list. So, like I said, I feel like that's like everything that you have to like fill out in the paperwork besides like insurance information. So that will make my job a lot easier tomorrow, and it'll bring down obviously my stress levels. I'm not gonna have to like feel like rushed like writing stuff out or anything. I think that's it for preparing for this appointment. I'm gonna like go over everything again tonight. Make sure, you know, my book bag's all packed. I'm gonna have all my infusion, and there's my infusion now, if you can hear that lovely beeping. Yeah, so I'm just gonna like make sure that everything's ready, double check all my meds, and all the stuff that you need to carry around these days for the virus, extra mask, gloves, all the things. I also carry around, because I'm so immunocompromised, I carry wipes with me, and I have gloves with me. I have several masks, so it's like I said, everything. So it's not fun, and, you know, it's not like the ideal way to travel, but, you know, you got to do what you got to do to attempt to stay healthy when you're chronically ill, and especially when you're severely immunocompromised. So I asked her, I go, Addis, can I get a picture with my doggy? She's like, yeah, let me lay on my side for you. So gastroenterology was not like as late as he has been. He's been ranging anywhere from like an hour late to about 3 hours late, which is a little bit frustrating. And it's difficult when you can't figure out if like he's running behind or like there's a technology issue, did he have an emergency, all the things. So it was definitely really nice that he was only about, I think, a half hour late. So that was really awesome. It was a really quick appointment. Basically, he's not doing anything or changing anything until the tumor comes out. He didn't really have additional input about the tumor at all. It's possible that that's making my nausea worse. It's possible that's contributing to the vomiting and just the GI issues, the pain, and all the stuff. That's all we really talked about. I asked him if he wanted me still on a medication he put me on in the hospital, and he told me I can come off. He was kind of like, well, that slows down your GI tract. Why would you want to be on it? And I was like, you put me on it. So, but other than that silliness, it went really well, I think, overall. I don't need to see him again until I guess I'm really stable enough for a colonoscopy. But we're not really sure when that's going to be because I don't usually heal like typically. So that's definitely going to be something that we'll probably have to revisit and talk about after surgery, you know, about how I'm healing and about when we're comfortable going in for that. And then, of course, too, it's going to come back around to how the pandemic's going and, like, where the second wave's at and all that type of stuff. So I'm not going to really, like pin down, like, a time frame of when we're going to have that done. It'll get done when it gets done. There's definitely nothing emergent to have the colonoscopy. I think, like, if we absolutely had to, it could be pushed back a couple months to possibly a year because of everything going on. I definitely do want some stability, you know, before going under. For that, I would at least like my blood pressure to be a little bit nicer. So Alright guys, so I think we're going to end this vlog here. Thank you so much from the bottom of my heart for watching. I will 110% definitely be vlogging tomorrow. I don't know how much or anything of that nature, but I'll definitely be documenting the journey. And I want to just say thank you so much for coming along with me for this journey, and thank you for your thoughts, your prayers, your comments. Thank you so much for watching this video. Please make sure to like and subscribe. Have an amazing day, and I'll see you all soon.